Hi, everybody. My name is Sarah. I am an intern in the Health Equity Department at Cascade Health Alliance, Klamath County's local coordinated care organization and administrator for Medicaid or OHP. So my main job is to reach out to community benefit organizations or CBOs and teach them about Healthy Klamath Connect and help them to utilize this great free resource. So I just want to preface this with the fact that everything I'm going to show you today is completely free. This isn't me trying to sell you anything. CHA already owns and provides this service for the whole community for free. So moving on, let's start this whole thing with what even is Healthy Klamath Connect? Why does it matter? Why should I care? So Healthy Klamath Connect is in essence a free online community resource guide that people can interact with. And by that, I mean that not only can people in need find existing free and reduced cost social programs and resources, but they can filter those programs, they can search by categories and by specific needs, they can see listings in over 100 different languages and actually connect with those programs all in one place, while the organizations that run those programs can claim and manage their listings, receive referrals, track the people that they are helping, and ultimately work towards closing the loop on referrals. So Healthy Klamath Connect has listings of over 1,500 different free and reduced cost nationwide, statewide, and local programs, all of which are available to residents of Klamath County. So seekers or those who are in need of help can access this platform and connect with programs themselves, or navigators, the people who are trying to help the seekers, can refer those seekers to these programs and keep track of and update the progress of those referrals. The programs themselves can receive referrals from the platform directly and can also track and update referral status. So HKC Healthy Klamath Connect is the Klamath branded version of Find Help. Find Help is something I may say a couple times throughout the presentation. That is the organization, the overarching organization that created and runs the platform, but CHA owns HKC. Slide. So a big part of my job is to help organizations claim their programs and set up referrals, which I will show you how to do in a bit, but first, what is claiming and what does it do? So claiming is essentially taking ownership of a program listing on Healthy Klamath Connect. I like to think of it almost like a verified account on social media, but it gives you access to a bunch of tools and really neat benefits. But once you claim your program, you can access and update your program's information. You can set up one-step referrals or create intake screeners and eligibility assessments or applications. You gain access to the inbound referrals dashboard and the people I'm helping dashboard, which I will go over later. You can set up availability and appointment scheduling. You can review reporting and analytics tools and more. And again, this is all for free. So now that I have kind of gone over what HKC is and what claiming does, I'm going to get into the nitty-gritty of how to navigate the site. So just go to whatever search engine you like to use and type in Healthy Klamath Connect. It should be the first link you see or the .org one, it doesn't really matter. When you click on that, it's going to take you to this landing page. So Healthy Klamath Connect is all pretty much through the lens of zip codes. So just type in a zip code somewhere within Klamath County. If a program serves one Klamath County zip code, the chances are it probably serves all Klamath County zip codes. But once you type in a zip, it's going to bring you to this landing page. The first thing that I wanted to point out is that I am not currently logged in. This site is accessible to anyone, so everything I'm about to show you for right now is available without an account and completely anonymously. Second thing I wanted to point out is that this entire site is available in over 100 different languages. You can also send individual listings in those 100 plus different languages as well, which I will show you a little bit later. Again, there are over 1,800 programs listed on HKC, again, composed of nationwide, statewide, and local programs, but we at Shaw are currently focusing in on local programs to Klamath County, of which there are currently somewhere around 144 listed. Whoops. So there are a lot of ways to find and connect with different programs on HKC, but to find them, there are all of these different categories and subcategories that you can really easily click through if you just want to see what's available within the different service types. So for example, if you want to find what is available for mental health care. You can go over to health and mental health, and under that you will find what is currently around 205 different programs listed. So that's a lot to look through. So you can filter this even further. For example, you can filter by distance by clicking closest. There's also a bunch of different personal filters available. So say you're trying to find something for a veteran who has a physical disability and is a senior. You can click on all of those different options and filter your search results to see programs that would best suit that person's type. So you can also apply program filters. Maybe you need a program that this individual can physically visit via a short drive, so you can apply a filter for that. But you can also filter to see only programs that are open at specific times, are free and not just reduced cost, or that can communicate in specific languages such as Spanish. And as well, many free and reduced cost programs also have specific income eligibility requirements, so you can filter by that as well. And then finally, of course, there's also just the search bar. This is great if you know of a specific program or organization that you want to look for, such as you want to look to see what Cascade Health Alliance has. So you type in Cascade Health Alliance and you can see their behavioral health case management program. Or you can also just search here by keywords such as like food. I'll also give you a little bit of a rundown of what you can expect to see on the program listing cards. So you will see the name of the program, the organization that runs that program, and when that program was last reviewed for accuracy. Then you'll see a little blurb about what the program is. You'll see tags for the main services that these programs provide and to what specific populations they provide them to. You'll see next steps for getting in touch with that program, so phone, location, hours, stuff like that. You can see more either by clicking on more info or by just clicking on the program name. So if a program has this little check mark, that means that the organization that runs it has claimed the program. And if they have this little badge, it means that the people running that program have done some additional training and are Find Help certified. So the other thing I wanted to show you here is that you can share program listings with people, and you can do this via email, text, or on Facebook. And again, this is something that you can share specifically in over 100 different languages on this share screen here. Moving on. So there's also a couple of ways to get in touch with programs. So going back and kind of looking at the cards from the public facing site, and again, I am not currently logged in, so this is available for anyone to do. But many programs have this little contact here button, which essentially means that the program has set up one-step referrals through Healthy Klamath Connect. So you can submit your or someone else's contact information with their consent, of course, to get in touch with the program. Some programs have a See Next Steps button, such as this one, where it provides you with an alternative best way to get in contact with a program, so such as calling a certain phone number. Other programs have an Apply Here button where you can fill out program-specific applications or screeners, eligibility assessments, stuff like that. But that's basically how you navigate the site. So I'm going to move on to, I'm going to show you how to claim a program. So something I want to point out real quick is that unlimited people from your organization can claim a program or programs. And can be added to your team. So whoever you need to have access to the claim program tools can, but this is how like that initial person can claim that program. So once you get to Healthy Klamath Connect, wherever you are on the site, just scroll all the way down to the very bottom of the page that you were on. And at the very bottom here, you will see this little button that says Claim Programs. When you click on that, it's going to take you to this page where you put in the name of your agency or the specific program that you want to claim and type in your zip code. So once you do that, it's going to come up with a list of different programs that it thinks could be correlated, but you find your specific program and can click on the claim button. Something else I wanted to say here is if you're from a specific organization, you don't have to claim every single program from that organization, but you absolutely can claim more than one or all of the organization's programs. So once you click on that claim button, it's going to ask you for some information. So like your name and specifically your work email address. Then it's going to ask you to create a password. Then you just agree to the terms, prove to the Google that you aren't a robot, and click complete your claim. Once you've done this, you've essentially just created your account, and anywhere from pretty much immediately to a couple business days later, depending on what Find Help has to do to verify you, you should receive a Find Help support ticket email that provides a claim confirmation. This email will look like this, and it'll essentially say, thank you for your request to claim a program. If you're an employee of the organization, sign in with your work email address. And once you do this and go through the prompts, you will have officially claimed that program. So make sure to keep an eye out for that email. If you don't get it within about 2 business days or so of submitting your request to claim with your work email, check your spam and junk folders, and if it isn't there, please reach out to us here at Cascade Health Alliance, and we will provide you with some contact information to be able to do that at the end of the presentation. So the next thing that I want to show you is what it looks like once you've claimed a program. So now that you've claimed your program, I'm going to show you everything you're going to have access to once you have done so and you have your account. So now when you log into your HKC account, your page is going to look a little bit different from the public-facing site. So with an account and a claimed program, you have access to a bunch of different program tools. I usually just access them up at the top here. But first I want to show you how you can edit your program listings. HKC does it, or Find Help does its best to get accurate listings, but they might not always be accurate. So always a good idea to update your programs, make sure all that information is correct. So go to My Program Tools and click on Edit Program Listings. You can edit from here you can edit your program as a whole, you can edit just your contact settings, or you can edit your hours and locations from this page. So you can click on the Edit Program button to change everything about your program, from the name of it to the name of your organization to your website links and the services you provide. This is where you can add service tags, which are really important to make sure people are finding and connecting with your program. You can add eligibility rules, all sorts of stuff that you can change on this page. You can also go back and click to edit contact settings, and this is where you can set up some form of referrals. So you can set up one-step referrals, screener applications, and appointment scheduling. We're trying to encourage as many organizations as possible to set up some sort of referral on HKC to support, again, closing that loop on those referrals. But you can choose from the different options for how people should connect with you and your program, and provide an email address or addresses that you would like to receive notifications about referrals to. Finally, with this page, you can update and manage the locations and hours of your program. This is pretty cool because you can also add like temporary pop-up locations. You can set certain locations to private, and you can set durations for locations or add new ones, as well as set temporary hours and such. But moving on. So I'm also want to show you how to manage your team. So as I said earlier, unlimited people can claim a program like how I showed you before, or you can add people to your program, to your team as well. And this is how you manage that. This essentially kind of just expedites the process of program claiming because you are specifically adding people to your team. So go on My Program Tools in My Team. This will take you to a page where you can invite team members to join a claimed program or programs, where you can edit that team member's permissions and statuses, where you can view that program and what programs which workers have access to. And this is also where you can deactivate accounts if you're an admin. So the main difference between like a worker account and a admin account is the ability to deactivate other accounts. But moving on from that, the People I'm Helping dashboard is the next thing I want to show you because it's a super helpful tool for keeping an eye on the people that you are referring to programs or that have been referred to your programs. So click on People I'm Helping and People, and it's going to take you to this page where it's going to show you all of the different people whose cases you have been involved with. So here you'll be able to see people you have referred to other programs, as well as people that have been referred to your programs. You'll be able to see all sorts of information about the people that you've been trying to help, as well as updates on the help that they have received or haven't received. You can add goals for people, edit personal info, you can assign people to their care team, you can add household information, see forms and documents associated with that individual. You can start a referral or add notes that anybody from your team will be able to see. And finally, you can update the status of a person's referral. So this information can be updated by the person that was referred, by the person that referred them, or by the organization that received the referral. So this is so you can see the most up-to-date status about an individual's referral process. And you can make those updates as well. You can also see who made what updates when to see that sort of information, but there's a lot of options that you can choose from. So say someone got sent to your program, but you need them to provide you with some documentation before you can get them help. You can indicate that you need a client action, maybe a person wasn't eligible for your program, or the ultimate goal, you were able to get that person the help that they needed. So next thing that I wanted to show you is the inbound referrals dashboard tool. So to access this, you'll go to My Program Tools and Inbound Referrals. And here you are going to see a list of all of the different programs that your organization has claimed, and you can see all of the referrals that have come in for those specific programs. So when someone is referred to your program, you will receive an email and they'll show up in this dashboard, but that email will go to whatever email address that you provided in your referral contact information on the edit contact information slide that I showed you. But that's going to look something like this. Make sure you check your spam and junk folders regularly just to make sure that they don't get sent there, because that does sometimes happen. But from this specific email, you can update the status of that referral directly from this email, and that's a good quick snapshot little way of doing that. Or you can also go back to your inbound referrals dashboard to see some more in-depth information about that individual and the referral, and to make more specific updates. So in this dashboard, you could see the status, the person who's inquiring, the person that referred them, when they were referred, when their case was last updated, any forms associated with that person, and available actions. So next thing I wanted to show you is the program analytics dashboard. So Healthy Klamath Connect captures all sorts of super useful data that you can use in reporting and just to catch snapshots of where your program and the people in your community are at. So you'll click on My Program Tools again and under Program Analytics. There will be a couple different reports available for you here. Yours is going to look a little bit different than mine. You'll probably have access to less reports. But for example, you can see a dashboard for your own activity that can show you details about the things that you've been searching for and the referrals that you've been sending and stuff like that. But this page basically includes all of the different reports you'll have access to, a little description about them, and then you can view that report and filter it however you may need. So for example, the screener dashboard shows data about your organization's screeners, and there's all these different filters up here at the top that you can use to drill down to really find the specific information that you need. My program analytics dashboard, again, looks different than what a community benefit organization or CBO might see. So I wanted to give a little overview of the reports that CBOs specifically will typically have access to. So there are usually 3 or 4 main dashboards that CBOs are going to see that will be helpful to them in terms of user engagement, needs analysis, and outcomes tracking. So you'll have the claimed programs dashboard, which will display how many people are interacting with your program in what ways, as well as how many referrals were received for that program and the status of each of those referrals. The search activity dashboard is great to see what the people in your community are searching for the most and how that changes over time. So this is a good way to measure what the needs are in your community and to potentially be able to tailor what your organization offers in response to that. The screener dashboard is for those that have set up intake screeners as their choice of referrals within HKC, and this tracks information like how many screeners have been submitted and how many are incomplete, how long it's taking people to finish those screeners, and how many people have been screened as eligible for your services. So the data collection report is the one that might look the most different of these listed. But basically this report is to show the additional supports your organization provides beyond that initial point of contact and of service, as well as the volume of submissions from your staff. So again, this one may look a little bit different depending on your listings and what you have access to. Moving on. One of the last things I wanted to show you is how to add programs to Healthy Klamath Connect. So if your organization has other programs that you think belong on HKC, or even if you just know of any other programs you think would be a good fit, you can suggest that program to try to get it listed. So to do that, again, wherever you are on HKC, just scroll all the way down to the very bottom of the page and you're going to see, again, these little buttons down in the corner here. And right next to the button where you clicked to claim your program is the Suggest Program button. When you click on that, it's going to take you here where it's going to ask you to put in some information about the programs that you would like to have added. So once you type all of that in, so like the name, some contact information, the website, stuff like that, it's gonna populate a little list and it might show you some programs that the system might think could be a potential match or are similar, just to kind of prevent duplicates from occurring. But if what you're looking for still isn't there, you can go down and add some more information about that specific program and submit the suggestion to Find Help. There is also an option where you can mark a little checkbox that says, I work at this program. And if you do that, then it can sometimes kind of expedite the claiming process. But once you suggest a program, Find Help is going to review your request, and typically within about 1 or 2 business days, you will get an email from Find Help that'll look something like this about their determination. So it's probably going to tell you, if they were able to list the program and provide a program listing link so you can view it if they were able to list it, or if they weren't able to get that listed, they'll give you their rationale as to why they couldn't. So that's pretty much the whole site, but the last thing that I wanted to talk to you about is if you want to get more specific training, more education, or you wanted to become Find Help certified, that is absolutely something you can do. So in your program tools dashboard, there is an option for ongoing education. This page offers information on how you can continue education with Find Help and even earn continued education credits. You can also go back and click on this support link where it's going to take you to this portal that has a ton of useful educational information, cheat sheets, educational sheets, all sorts of stuff. You can even type in the word certified into the search bar and click on like this little informational sheet about becoming Find Help certified and what that means, how you do it, why you should. But there's a lot of really useful information in this portal. So if you ever run into snags or are curious about something, I recommend just kind of going in and seeing what's available in this portal. But that's it for this presentation. If you need any additional help, if you need technical assistance, if you want to set up another demo, even beyond things that I covered in this program, in this specific presentation, please feel free to reach out to us at Cascade Health Alliance at the Healthy Klamath Connect at Cascade Comp email or at the phone number provided. Please feel free to send us your questions or your comments or concerns. Thank you.